While multiple muscles contribute to wrist flexion, two in particular, Flexor Carpi Radialis and Flexor Carpi Ulnaris, play a central role. The function of these muscles is assessed together, as well as separately. To reduce the contribution of the flexors of the fingers and thumb to wrist flexion, patients should keep their digits and thumb relaxed during wrist flexion tests. Gravity-resisted wrist flexion is assessed with the patient seated, forearm supinated, and the wrist neutral or slightly extended. The therapist supports the patient's forearm under the wrist. To test both wrist flexors, the examiner applies resistance to the palm of the test hand. Resistance is given evenly across the hand in a straight-down direction. To test the Flexor Carpi Radialis, resistance is focused over the second metacarpal, or radial side of the hand, in the direction of extension and ulnar deviation. To test the Flexor Carpi Ulnaris, resistance is focused over the fifth metacarpal, or ulnar side of the hand, in the direction of extension and radial deviation.
Bend your wrist up. Hold it. Don't let me pull it down. Keep your fingers relaxed. And relax. Bend your wrist. Hold it. Don't let me pull it down. Keep your fingers relaxed. And relax. Bend your wrist. Hold it. Don't let me pull it down. Keep your fingers relaxed. And relax.
When assessing wrist flexion for a grade 3, the patient is positioned the same as the previous test. For both wrist flexors, the patient flexes the wrist straight up without resistance and without radial or ulnar deviation. For Flexor Carpi Radialis, the patient flexes the wrist in radial deviation. For Flexor Carpi Ulnaris, the patient flexes the wrist in ulnar deviation. The grade 2 test for wrist flexion is performed with the ulnar side of the hand resting on the table. The therapist supports the patient's forearm proximal to the wrist. The patient flexes their wrist with the ulnar surface gliding across or not touching the table.
Bend your wrist, keeping your fingers relaxed. And relax.
The grade 1 and 0 wrist flexion tests are performed with the patient's forearm supinated. As the patient attempts to flex their wrist, an index finger is used to palpate the Flexor Carpi Radialis on the wrist just lateral to palmaris longus, if the patient has one. Similarly, the tendon of a Flexor Carpi Ulnaris is palpated on the medial aspect of the wrist during attempted flexion.
Try to bend your wrist. Relax. Try to bend it again. And relax. Try to bend your wrist. Relax. Try to bend it again. And relax.